Hey everybody, and welcome to my channel. My name is Kaylana, and on this channel I talk about all things nursing and I answer questions whether you are a pre-nursing student, nursing student, or you are a nurse considering applying for CRNA school. I also will start vlogging my experience as a student CRNA, aka SRNA, starting January of 2022. So if any of that interests you, then please consider subscribing, hit the notification bell so that you don't miss a single video, and share with a friend. So this video is just going to be a mini Q&A of the questions that I received under some of my videos, and they're really good questions, so I figured that I would share the answers with everyone. Some of the topics that I plan to cover today are whether a grad nurse should start off in the ICU, a little bit about nurse residency programs, what is too old to go to CRNA school, and a few more. So if any of those interest you, then please continue watching. So if I'm looking down, then I'm reading from my laptop. I'm reading from the comments underneath my videos. If you have a question that I don't address today, then go ahead and leave a comment down below. I do reply to all of my comments. If I do get enough questions, then I'll just do another Q&A video. So I hope that you find this helpful. So Abina, I hope I'm pronouncing your name correctly, asked if I could do a video on what ICUs look best when applying to CRNA school. So if I can think of a lot more information, then I will do a dedicated video, but for now I'll just include it in this little mini Q&A. So in my opinion, all ICUs are not created equal. So it really depends on quality of the types of patients that you see. And when I say quality, I just mean like how sick they are, what they require. For example, there's a difference in, a DKA patient that comes in with their, labs all out of whack and with metabolic acidosis and unresponsive versus the ones where, you just are sending labs like every few hours and changing their insulin drip. I mean, both are, they're the same cases, but one is clearly sicker than the other. So that's what I mean by ICUs are different. I would say that as long as you're getting adequate exposure to patients on the vent and to pressors and other medications in the ICU, then I think that it will prepare you for CRNA school. CRNA schools typically take students from the different ICUs, including NICU and PICU. If you do have a question about whether or not your particular ICU is accepted, then you might want to contact the school that you're interested in, but generally all ICUs are accepted. Let's just say all things being equal, I personally would say that either a surgical ICU or maybe a CV ICU or CCU would be great to prepare you for CRNA school, just because they have a lot of hemodynamic monitoring, and then the SICU does prepare you for patients before they go to surgery and after they come out of surgery in some cases. And then the NICU and the PICU, obviously, because you're dealing with children, whereas you don't get that exposure most times unless you've worked in that specialty before, going to CRNA school. There's two systems in my city, and both of the major hospitals are downtown, probably within 5 miles of each other. One is a level 1, one is a level 2. The level 2, their CVICU does the lung and heart transplant patients, ECMO, VADs, and then all the other little gadgets, whereas the one that I actually went to, they don't do those things, and they started an ECMO program, but they had to discontinue it because they weren't able to support it at that time. They're the same unit, and theoretically, level 1 is supposed to be the highest level of care, at least by definition, for trauma patients, but the CVICU did not offer the same services as the level 2. So if you have the option to choose between which ICU you're going to go to, because let's be real, a lot of us only have the option to go to one, and then if you only have one option at that time, you're most likely going to take it. If you have more than one option, then you should ask those type of questions. You know, what type of patients are coming through, and how likely are you to see, you know, a patient who's on multiple drips, who, you know, is using a device, or whatever the case may be applicable to your ICU. Hopefully that answers that question. The next question that I have is from the Stone Chronicles, and they ask, do I recommend new grad nurses starting in the ICU? My opinion is that it really depends on you as a person. I was gonna say as a nurse, but if you're a grad nurse, you don't really know what type of nurse you are. So it depends on you and, you know, what you think that you can handle. I do think that a grad nurse can start off in an ICU, but I think that the ICU has to be supportive, and they have to want to work with the grad nurse, because not only are you learning, you know, critical care, you are also learning how to be a nurse at the same time. I mean, nursing school is just the tip of the iceberg, kind of runs you through a few things, but it's not truly going to get you right where you need to be just on a drop of a dime. So with that being said, I had another question in here by AW. AW is going to be graduating in December of 2022 and would also like to go to the ICU right away. So AW asked if I can make a video on how to get into the ICU as a grad nurse, and I will make a dedicated video. But I will say in this little mini Q&A that one thing that can't hurt is getting a job as a tech on an ICU. So not only will you get experience working in the ICU, you know, kind of get the vibe, you can also network. Networking, if you don't already know, is kind of that situation. It's not what you know, but who you know. So, you know, if you're already working on an ICU and the manager gets to know you, sees your work ethic, they trust you, then if they do hire new grads, you are more likely to be considered than somebody who they haven't seen before. And even if you're not applying to the same ICU that you are a tech in, having tech experience in the ICU will help you. Now, some ICUs don't have techs, so it's kind of, you know, a situation where it might not even be an option for you, but it definitely doesn't hurt. Now, more nurses that work in the ICU than not were never techs, or, you know, they didn't follow that path, so it's definitely possible. But that goes into your next question. AW asked if I thought it was a good idea to look into ICU residency programs. If you don't know, ICU residency programs are created for new grads, basically to kind of groom them for usually critical care, and they last anywhere from 6 to 12 months. In my opinion, the longer the better, and they include, you know, different classes. So for example, they may have a class on arrhythmias, because the same type of arrhythmia can have like little variations. And for me, even having been a CVICU or working in MICU, which was also CCU for that particular hospital, it's not always quite clear what type of rhythm you have on a strip without further investigation. And I'm talking about a regular strip. I haven't even gotten into a 12 lead. That is an entirely different ball game. So graduate nurse residency programs, know that they're taking a nurse with usually less than a year of experience from graduating, and they do those classes like I was talking about, and then sometimes they place you in a unit, and sometimes, you know, you sign up with the understanding that you're going to a specific unit. I think that that's a better setup to walk into as a new grad than getting hired on an ICU that doesn't have that type of programs. If you have an option, I would choose the one with the residency program, but if it's not an option, then it is very important that that unit is supportive and they have some type of, you know, guide in place for how they're going to train you. I would definitely ask how long the training will be. 6 months as an experienced nurse was kind of when I started getting more comfortable. And then there's always a situation where, you get something that you've never had before. So at least the 6 months, and then, sometimes you do it all the way up to 12. Some of these programs will require you to sign a contract, and it's usually for 2 years, and that could be for a number of reasons. Contracts are not my favorite, but I have signed a couple of them. Just know that with contracts, you will likely have to pay the hospital a certain amount of money if you don't stay the certain length of time. There are arguments as to whether or not you should sign a contract, but I think that's a video for another day, and it's also very much a personal decision. They want to know that you're going to give them the time after you've been trained and not take your talents elsewhere. Now, to talk about what's too old to go to CRNA school. And it's been asked more than once, or at least implied, so I'm sure there's many of us out there that have thought about it, and some of you have asked. So my opinion is that there's no cutoff for when you go to CRNA school age-wise. There's a lot of variables that play into that. For example, the older you are, the more likely that you have other responsibilities. So, a 21-year-old or 22-year-old may not have a spouse and children and a home that they own and expenses that go with it, like someone who may be in their 40s. And the older that you get, you're more comfortable with certain things, you're used to living a certain lifestyle, to not work, because the CRNA programs usually don't let you work. If you can work, it's usually only for the first semester, and then after that you will not be working for 3 years. So to go from what's usually a comfortable lifestyle as a nurse to one or no additional income is a big adjustment for a lot of people, especially the older they get. If you didn't go to CRNA school because you're in your 40s for that reason, it's not necessarily because you're in your 40s, it's because you need that additional income, which is understandable. But as far as age is concerned, I don't think that 40s, even 50s is too old to learn. It really depends on you. If you think that you can be disciplined and learn something like that or participate in such a rigorous program, then I say do it. Because my logic, because I had this thought myself, is that I'm going to age whether or not I go to CRNA school, so I might as well. I wasn't going to do it bedside. Nothing against bedside nurses, but I just knew that there was going to come a time where bedside wasn't for me. If you're considering CRNA school and you're one of those people who are wondering if they're too old, I guess my question to you would be, what's the alternative? Because you're either going to work bedside, I'm assuming that you're bedside. Well, yeah, you'd be like ICU. So you're either going to work bedside until some point later, and usually that's either to take some other kind of nursing job, maybe not bedside, or you'll go to school to be an NP. And either way, you're going to go to school. So if you're able to get into CRNA school and that's something that you're interested in, then you might as well. So next question. Takita says, I am applying to nursing school and my plan from day one was to become a CRNA. What would you say is the best critical care unit to work to prepare you for CRNA school? And Takita wants the sickest of the sickest patients. And just kind of going back to which ICU is best for CRNA, it still really depends on the type of patients that the particular ICU has. I have seen some very ill patients in MICU. There are sick NICU and PICU patients. I did decide to go to CCU because I wanted more experience with hemodynamic monitoring, but it was only because the MICU that I was in didn't use a lot of those to begin with. Not to say that other ICUs don't use, let's say, like a Swan Scans catheter or something like that. There's really no right or wrong answer, But for me, the sickest of the sick patient was going to be CVICU, and if I could do it all over again, I might have chosen to go to the level 2 instead of the level 1, just because, like I said earlier in the video, they had more critically ill patients based on the type of services that they provided. I hope that answered some of your questions. If you have any additional questions, then you are welcome to leave a comment below. I do respond to all of my messages in time. If you did find this video helpful, please consider hitting the subscribe button and the notification bell so that you don't miss a single video, and hitting the like button because it does let YouTube know that you like this kind of video and it shares it with others who might also be able to benefit. So I'd like to think of myself as your friendly nurse mentor. So if you are a pre-nursing student, or a nurse thinking about applying to CRNA school and you have a question, please feel free to either leave a comment or you can follow me on my Instagram, which is Nurse Kaylana. And yeah, that's basically it. So if you enjoy this channel, please share with a friend. I hope you all have a good week, and I will see you on the next one.